we're not organizing this on our own as Europa Patient Association. So thanks to FEPS, to David Rinaldi, Foundation for European Progressive Studies, which was absolutely instrumental for making this happen. Thanks to our host here in Cieszyn, to Krytyka Polityczna Świetlica w Cieszynie. Thank you very much for providing us the venue and all the help with organizing that. Thanks to our Czech partner, whom we found also really important in this discussion, to Masarykowa Demokratyczna Akademia, to Progresywnie Analityczne Centrum, and last but not least, to Centrum imienia Daszyńskiego, who also was very important for making this happen. So let me just say a few brief words why actually we are organizing this conference. And why did we bring politicians and experts and just people engaged in public health matters together? The reason is very simple. It is because we think health is deeply political. First of all, because proper analysis, proper expertise of problems of health really requires understanding the political dynamic. The questions we will be discussing, so privatization, social and regional inequalities in access to health, the burden of long COVID on workers, on the economy, on healthcare system, mental health crisis, these are all issues, problems that have political causes, and something we will discuss, I think, they also have political effects. And the second reason why we think we really need to think about health politically is that to address these problems, we need political vision and political boldness, political will. I've been using the words like challenges and problems quite a lot, but progressive forces, however we want to define it, because we are a cross-partisan organization working with different political families across the political spectrum. Anyhow, the progressive or pro-social forces have always won and built their strength when they were creating policies that actually brought health for all, to recall the title of our conference again. And just to sum up, if I would to propose a tentative framework for our discussions, I would just say two things. And this is something that we bring from our work in advocacy, on implementation, on other matters, like green transition, for example. So, first thing that I would say is that we should not be defensive. Retreating under the pressure of pseudo-libertarian, social Darwinistic, anti-social political forces on question on health makes us weaker on other questions. Climate, you name it. So access to clean air, to healthy food, to accessible support during pregnancy, etc., are not only questions of our safety or security, they are our fundamental liberties. And we should be bold enough to defend and to define them as such. And the EU, and this is our fundamental belief, will only strengthen its legitimacy only if it is connected in people's minds to actual programs that bring solutions that help them to take care of their health. And secondly, and again, something we bring from our experience working on other matters, it's very hard to convince, for example, a miner to support a green transition. But we see this happen wherever the programs we were facilitating brought decent jobs, brought development to the regions. So we think we just need similar case studies, working case studies in the matter of health, just to show that the local government, with support of national government and the EU, can, for example, provide good air quality in public schools, in public buildings, in workplaces. So just to sum up, we need boldness, we need case studies that show that this could work for people in their places. So I'm really looking forward to these discussions, and without further delay, I will pass it now to David, and I will also, David, let you, if you can, to introduce our esteemed guest, because we will have two very exceptional speakers at our opening panel. So, David, the floor is yours.
Thanks a lot, Mateusz. Please let me thank Mateusz. And with that, not sure it works. Probably yes. I hope it does. And big thanks to all your colleagues as well at the Europa Patient, and as you mentioned, our partners here in Poland, the Dashinsky Center, and the Mazarykova Academic in the Czech Republic, as well as the Progressive Analytical Center led by Petricek, that is here with us. It's maybe someone in the... Thank you, super, appreciate it. Daily towards equality and fighting inequalities. It's fantastic to come back to Poland and find somehow a new vibe in this country, where Europe is no longer the enemy, but is something that we can shape together for the benefit of the many. This is, I would say, really refreshing to find a new partner, a new big political partner for collaboration, and the presence of Deputy Minister Pieszna Wiciewicz is here to testify that we start from the real needs of the people, including prioritizing at government level mental health, inequality, fighting inequality since the early years. You have seen that the title, besides focusing on health for all, is also an attempt to move from a slogan to reality, to clear policies. And this is what we would like to achieve in engaging with you. Many of you are political actors, engage in youth associations, professional associations, high-level think tanks, political parties. The feeling is not only to have a conference, but is also to underline what are the possibilities that we can have besides this moment of, I would say, almost constant electoral narrative. You just had an elections in Poland. Soon there will be the European elections. But in the European elections, crucially, they mean a new beginning of a legislature in Brussels. And that is the moment in which we have to put in the work program of our common union the things that we wish to see for the next 5 to 10 years. So the issue is a little bit, of course, to tell the good things that have been achieved, or the things that we prioritize, but it is a political and policy work to literally force the European Union to move steps in the right direction. You are all aware that with COVID-19, the European Union experienced a little bit this need to cooperate politically on health. The buying together vaccines was probably a big thing, and there is this feeling that Europe needs to do more on health for everybody. But the tools, we will hear it in a second, the tools in the hands of Europe are still relatively limited. So we need to basically define the space for political cooperation. And unless we are really active as lefty operator, social democrats, socialist, progressive, pro-equality people, or the model that is being defined now in Brussels is a model led by the center-right, in which the idea put forward by the Social Democrats of a European health union might even end up with something on a data space for health, which is okay for research, but I think people need a little bit more than cooperation on data only. So that's a very minimum part. And another initiative on fighting cancer together, which is okay, it's nice, but very much focus on treatment only, which is relatively, also, I wouldn't say captured, but in the interest of some pharma. So we have this ambition of delivering high quality for all. It cannot be that Europe is active on these two things only. So there has been a move to, to go in the direction of a European strategy on mental health. We are thinking about, internal market, financing, regulating pharma, prices, setting minimum standards. There's a lot to do in order to help national health systems to improve. So today we will look at different aspects: privatization, marketization, mental health, regional and territorial inequalities, perhaps even touching upon this difficult issue we were discussing even yesterday of many qualified doctor, nurses from Poland, Czech Republic, Hungary, Bulgaria, moving to other countries, living somehow a little bit of difficult solutions for those that live here. So a long list of topics today. We will try, given the setting that is also rather informal, let's maintain it informal. So we will have speeches, and many of you will have your own say. But in a sense, feel free, take the floor, raise your hand, comment, engage a bit, because the issue here is also to confront each other. Most of us are, I would say, specialists of politics or health policies. So it's a moment in which we have to reinforce a common agenda. Yeah. So don't feel shy in these more in this setting or informally. Please engage, share, because it's the togetherness that can give us a little bit more power at the European Union level, and that is why we chose also this town. That is, from our viewpoint, a good place to talk about the European Health Union, because if I'm not wrong, it's not even 100 meters, and you are in another country. You are in the Czech Republic. So the feeling of having real European services, European standards. It cannot be the case that you have certain quality here and certain prices here, certain quality there and other prices there. This is something that we should not accept, because people are moving, and because we are all human beings requiring decent standards in health, housing, transport, and more. But you're not here to listen to me, so let's stop here and let's go to the real serious intervention, because we want to hear a lot about what are the plans as well of the current Polish government in understanding what are the way to fight these inequalities we've seen during the pandemic, affecting a lot people, from housing and education and health, is always the more vulnerable that were impacted the most. And it is also the more vulnerable that now have big issues with mental health that has become truly a problem for the many, I would say, in many households. It's a relevant issue. How do you see the societal problem, perhaps, of the connection between health, inequality, also linking to education, which is your portfolio, and the struggle of the young people? I pass the microphone and the floor to Deputy Minister Paulina Piśna-Wieczkiewicz.
Thank you, David. Dziękuję bardzo. Będę patrzeć.
Thank you very much. I will try to observe the time limit so that everybody has a chance to speak. I will begin with perhaps COVID and how it affected Polish schools
a wpływ miał
and it
wielki, to
affected
jasno
Polish
wynika
schools
nie
significantly.
tylko na pewno z
And
naszych
this
osobistych
is the
opinii,
outcome not only of
ale
our
również polecam
personal
bardzo
experiences,
serdecznie
but
raport
also
Najwyższej
we can
Izby
see it in the
Kontroli,
report of the
który
National
wykazał to,
Chamber
co
of
można
Supreme
było
Control,
podejrzewać,
which
że działo
could
się,
have been suspected
czego
that was
konsekwencją
going
jest
on, and
COVID
the
i
consequence
brak
of
działań
which is the COVID and the
odpowiednich na
lack of
szczeblu
appropriate
rządowym.
measures
Otóż
on the governmental level.
oczywiście
Obviously,
COVID i nauczanie w trakcie COVID-u
and teaching
to
during
była
the
rzecz,
COVID
z
pandemic
nie
was
tylko rząd polski
something
musiał
that not
wcześniej
only Polish
miał
government
i musiał mieć do
had to
czynienia i musiał
face
reagować.
and had to react
Natomiast
accordingly.
środki, które zostały
But the
podjęte, były
measures that have been
niewystarczające.
taken were
W
inadequate.
konsekwencji
As a consequence,
dzieci i młodzież
children and
po
young
pierwsze
people
nie miały dostępu
did
do,
not have
do
any
dobrego
access
jakości nauczania
to good
w równym stopniu,
quality
prawda? No bo oczywiście
teaching
zależało
in
to
an
od
equal level.
podejścia dyrektorów
Because
szkół, od
this all
pracy
depended on the approach of the
nauczycieli. Nie
directors
miały
and the
w
work of
trakcie
the
zdalnego
teachers
nauczania, bo ten
during
model
online
Polska
teaching
wybrała i
period,
rzeczywiście w
because this
Polsce
was the model that
okres zdalnego
Poland
nauczania
selected. And in
trwał
Poland,
relatywnie
the
długo w
period
porównaniu
of
do
online
innych
teaching was relatively
krajów.
long
Więc
in
mieliśmy do
comparison
czynienia z
with other
całym
countries.
wachlarzem rzeczy,
That
które
is
po
why
prostu
we had to
musiały się
deal
wydarzyć.
with a plethora of
Wykluczenie
things that
cyfrowe,
had to happen.
brak dostępu do
Digital
odpowiedniego
exclusion,
sprzętu,
the
mimo
lack of
prób
access to
państwa,
appropriate
chcę wyraźnie
equipment
powiedzieć do
in
tego, żeby
spite
ten
of
dostęp
many
zapewnić.
attempts
Niskiej
on
jakości
the
łącze,
governmental level,
jeżeli chodzi o
poor
internet,
quality
bądź
of
w
internet
ogóle problem z
connection,
dostępem
or
do
the
internetu,
lack
co
of
musiało
any
się
access to the
oczywiście
internet,
przełożyć na to,
which obviously was translated
wiedzy,
to the
wyniki
access to knowledge
również
and also
uczniów.
the teaching
Ja pamiętam
results.
te, ponieważ
I
ja
do
mam córki, które w
remember
tej chwili mają 12-15 lat, więc wtedy
two
były
daughters,
odpowiednio
they are
młodsze, ale
15 and
pamiętam,
12,
jak
they
moje
were
dzieci
younger
płakały,
obviously
kiedy
during
nagle
the
w trakcie
pandemic,
testu
and I remember
zrywało
how
po
they
prostu
cried
połączenie.
when
I
the
oczywiście
connection
jest
was
to
broken
obiektywne,
at
tak?
the
To
moment
nie
of
jest
a
niczyja
test that was
wina,
being written.
natomiast tak
Nobody
po
is
prostu
to
się
blame
działo.
for it.
I
This
to, co
is what
wykazuje
happened simply.
raport Najwyższej
And
Izby
the
Kontroli,
report
to
of
znaczne
the
pogorszenie
of the
kondycji
National
psychofizycznej
Supervisory
dzieci i
Authority
młodzieży,
was
również
the
nauczycieli.
digital exclusion of children
Kwestia,
and
więc
of
jakby kwestia
teachers.
równości
So the
dostępu
issue of
do
the
odpowiedniego
equality
sprzętu
of the
musiała
access
mieć
to appropriate
też wpływ na to, o czym dzisiaj
also had
rozmawiamy.
to
Tak?
affect what
Czyli
we are talking
nierówności
about today. That
zostały
is
jeszcze
inequality, lack of
pogłębione, te, z
balance.
którymi mieliśmy do czynienia
Inequalities were
wcześniej,
deeper
one zostały
because
pogłębione.
of the
Najgorsza
pandemic
chyba
and the
sytuacja
circumstances in which we existed
to
during the pandemic.
sytuacja
And the worst situation
dzieci, które
possible
w pewnym
was the
momencie po
situation
prostu
of
przestały albo
the
miały utrudniony
so-called
dostęp do zajęć
dropout
terapeutycznych,
children
do
who did not have any access
rewalidacji.
to therapeutic
Mówimy o
classes
dzieciach ze
or
specjalnymi
revalidation.
potrzebami
I mean here
edukacyjnymi.
children
Oni
with
i
special
ich
educational
rodzice
needs.
zostali
Their
sami po
parents
prostu
were
bardzo
left
często z
alone
tym problemem,
frequently with the
szczególnie w
problem
małych
that they had,
miejscowościach, gdzie ten
especially
dostęp
in
i tak
small
jest
towns
siłą rzeczy
where
w
the
Polsce
access is by all means
utrudniony.
limited and more difficult.
Wyszliśmy z COVID-u
We
i właściwie jest tyle
went through the
kwestii, które
COVID
dzisiaj będą
pandemic, it's
omawiane i
over,
o których trzeba
but
byłoby
still there are so many
powiedzieć.
issues
Od
that need to
zdrowia
be discussed.
psychicznego
To begin
począwszy,
with mental health and
na prawie
to
na przykład uznanym
end with
rezolucją
the,
ONZ-u, czyli prawie, powszechnym prawie człowieka
the general
do zdrowego,
right
czystego
to
środowiska, bo jak rozumiem, o tym też
healthy
dzisiaj
and clean
będziemy
environment,
rozmawiać. Więc
which is
polski
acknowledged
rząd
by the
ma
European
w tej chwili
Union.
bardzo wiele
So Polish
wyzwań
government
przed sobą.
faces
Ja
a
może
lot of
zacznę
challenges in this
od
respect. So let me begin
nierówności,
with inequalities.
jeżeli chodzi o
When it comes to
to, z czym mamy do czynienia,
what we
czyli
are
jest
dealing
ujemnym
with,
przyrostem
that is the,
naturalnym i ten
negative
problem, który
birth rate,
już
the
mamy
very
i za
low
chwilę się
birth
pojawi.
rate.
Mamy ujemny przyrost
we
naturalny,
have the,
tendencja jest jednoznaczna, w związku z czym za chwilę okaże się, że w wielu małych miejscowościach będziemy mieli problem z ilością liczbą uczniów w klasach.
smaller number
Bardzo
of
chcemy,
children
żeby
in
ten problem
schools.
rozwiązywać
We would
nie
like to solve
w
this
sposób
problem
najprostszy
not
pewnie
in the
dla
simplest
niektórych, czyli
way,
likwidowanie
that
szkół,
is,
tylko żeby
closing
włączyć
down
małe szkoły,
schools, but including
rozszerzyć jakby
smaller schools and
zakres
expanding
usług publicznych,
the scope
które
of
byłyby w
public
tych małych szkołach
services which could be
prowadzone,
offered
połączyć
at
usługi,
schools to
tutaj
connect the
połączyć,
services
pożenić dostęp do kultury,
for example,
też
with
jest
the
bardzo
access
często
to culture,
utrudniony,
which
dostęp
is
do zajęć
frequently
dla
also
seniorów,
difficult, or
seniorek,
classes
to jest
for
też bardzo
seniors,
zaniedbana społeczność w Polsce, żeby te
which has also
nieruchomości,
been neglected,
żeby samorządy
so that local
miały
governments
pieniądze,
could have
tak, czyli żeby nie
resources,
musiały używać argumentu
so that they
finansowego
did not
i żeby
have
można
to
było
use the
połączyć
financial argument
różne
in
środowiska,
the
żeby
debate,
szkoła stała się
and
centrum,
so that
rzeczywistym centrum
school
życia
should become the
lokalnego,
real
co
center
działałoby
of
dobrze,
local
jeżeli
life,
chodzi o usługi
which
publiczne
will
i życie
also improve the
lokalne
level of
per
public
se,
services
ale też
and the life
finansowo
of
miałoby to
local
po prostu
community, and also
sens.
financially
Mówię o
it
tych
would
małych
make
szkołach, bo to
sense.
jest pytanie, które
I'm
bardzo
talking about
często się
small
ostatnio
schools
pojawia w
because it
kontekście
is the
ujemnego
question
przyrostu naturalnego.
that is
Poza tym
frequently
rzeczywiście dla
repeated in the case
zdrowia
of
psychicznego dzieci i
negative
młodzieży to jest
birth
bardzo
rate.
ważne,
So
żeby
it's also
uzyskiwać
important
wsparcie
in
w
the
swoim
case of
lokalnym
children,
środowisku.
so
I
that
to jest
we could
kluczowe,
get
bo tam
support
jest
and could
najbliżej
provide
rodzina, tam są
support
przyjaciele,
in the
więc
local
likwidacja
environment.
masowa
That
małych
is
szkół
why the
miałaby
mass
również
liquidation
duży
of
wpływ
closing down
na
of smaller
kondycję
schools
psychiczną
would
dzieci
also
i
affect
młodzieży.
mental
No ale co
condition
jest
of
z tą
children and
nierównością?
adolescents.
No
So
nierównością
what
jest
about
też
the
brak psychologa w każdej
inequalities?
szkole.
Also the lack
Tak?
of a
My mamy
psychologist in every
rozpoczętą
school.
reformę, która
We
zakładała
started the
obecność psychologa w każdej polskiej szkole. W tej
reform
chwili
which
ta
guarantees
obecność
the
plasuje się
presence of a
na poziomie
psychologist in every school.
75%.
Currently it is on the level of
75%
75%, which means that in 75% Polish schools there is a psychologist
I można by
on
powiedzieć,
duty,
że to
whereas
i tak
in 25% schools are missing the
ale
psychologist. They do not have psychological services.
To oznacza,
Perhaps it's not
że
much, but
4000
we have a lot of
polskich
schools.
szkół
This
w
means
ogóle
that in
nie ma
4,000
To znaczy,
Polish
że jest
schools there is no
400 ponad
psychologist
gmin w
on
Polsce,
duty,
w
which
których
means
nie ma psychologa
that there is more
w
than
szkole. Psycholog w
400
każdej szkole
municipalities
to jest
which
kluczowa,
do not have a
podstawowa
psychologist
sprawa
at
do
school.
tego,
A
do tego,
psychologist
żeby
in every school is
rozwiązać
of key
kwestie związane z
importance,
dobrostanem
so
dzieci
that the
i
issue
młodzieży.
related to the welfare
Również
of children
dlatego,
and
że po
adolescents
prostu,
should be resolved.
Dostęp do
Also,
psychologa
the
prywatny,
access
gdyby ktoś
to
chciał
a
się do
psychologist
psychologa udać,
privately, if
to jest
somebody
bardzo kosztowna
wanted to
wycieczka,
approach a
bo to jest
psychologist, is
przynajmniej
really costly
mniej
because
więcej
this is
około
at
200
least
zł
about 200
wzwyż.
zlotys
Pewnie
and
można
more.
gdzieś tę usługę
Obviously,
znaleźć
this can
taniej,
be
ale
at a
zazwyczaj
lower price,
jest to większa kwota.
but
Jeżeli
usually
dodamy do
this
tego,
is
że
the price
terapia
range,
dla niektórych dzieci
adding
to nie jest
that
kwestia
the
jednej
therapy
wizyty
for
miesięcznie,
many children it is
tylko
not
kilku
one
wizyt,
session per month,
miesięcznie,
but
to
a
robią się z
couple
tego
of visits per month.
bardzo poważne
This means
kwoty. I to, co my robimy i chcemy zrobić, to po
that
pierwsze
needs to be
zapewnić
spent.
psychologa
So
w każdej
first of
szkole,
all,
to znaczy
a
dokończyć ten proces,
psychologist
w
should
którym w
be
każdej szkole
available in
dostępny
every
jest
single
psycholog.
school.
Zainwestować w
Also, we
poradnie
should invest in the
psychologiczno-pedagogiczne jako
development of
integratora
psychological
właśnie
and pedagogical
działającego na rzecz
outpatient
uczniów i
consultation
rodzin,
rooms,
rodziców.
so
Bo to jest
that they
kolejna
could
kwestia. W całym
support
procesie
children,
reformowania
students and the
psychiatrii
parents,
dzieci i
because
młodzieży
within the
gdzieś
process of
umyka
reforming
zaangażowanie rodziców do
psychiatric
tego procesu.
services for
Bez
children and
rodziców
adolescents, we
zaangażowanych
frequently
żadna
forget
terapia,
about the
tutaj są
involvement
dzisiaj
of
z nami na
parents.
sali
So
lekarze,
we
po
need
prostu
to remember
nie
that
pójdzie
without the
do przodu
involvement of
i nie
parents,
będzie dobrych
no therapy
efektów.
will progress.
Dlaczego mówię o tym programie? To
Why
jest
am
program
I
dla
talking
poradni
about this program? There is a special
psychologiczno-pedagogiczny
program
realizowany
for
ze środków
pedagogical
we
and
współpracy ze szkołą
psychological
główną handlową. On
consultation
ma
room, which is carried
uczyć
out from PEPS
nauczycieli,
resources,
specjalistów,
which is
pracowników
meant to
poradni
teach specialist
psychologiczno-pedagogicznych, jak
teachers
tym
and
integratorem
the
być, ale jest
pedagogical,
też
psychological staff of such consultation rooms,
dla
and also there is
samorządów, dla
70
organów
million
nadzoru
zlotys
na
for local
doposażanie
governments, for
poradni
supervisory organs, bodies
psychologiczno-pedagogicznych.
to
Ubiegamy się,
provide
będziemy
more
realizować
and
również
better equipped
programy,
consultation
które będą
rooms.
trochę nowum
Also, we
na
are going to
polskim,
develop
w
programs
Polsce.
which will be
Mówię
some
tutaj
kind
o
of
wsparciu
novum in the
rówieśniczym, o
Polish
peer
market.
support.
I mean peer
Tutaj
support
będziemy się
here,
też ubiegać o
because
środki, to
we
są
are
takie
going
środki
to apply
w ramach
for
innowacji.
resources.
Chcemy, żeby
And there
młodzież,
are
która i tak jest
resources
zaangażowana
available
w pomoc
within
swoim rówieśnikom,
innovations
przy
program,
pomocy
so that
nauczycieli
children who are
koordynujących
involved
tego
in
rodzaju
supporting
pomoc,
their peers
mogła
with
tą pomoc
the
dostarczać w bezpiecznych
presence of
warunkach.
teachers. So
Oczywiście
such help and support
wszystko
should be offered
byłoby
in safe conditions.
zadbane, to jest bardzo
and
istotna
everything should be taken
rzecz.
care of.
To,
So
co jest dla mnie
what
osobiście najważniejsze i o co
I
walczyłam w
personally
zeszłym roku,
regard as
to
of
współpraca
extreme
międzyresortowa.
importance is
My
the
skierowaliśmy, nie chcę bardzo
intrasectorial
wkraczać w politykę, ale
collaboration. I
już tak
wouldn't
zakończę
like to get
takim
into
może
politics
optymistycznym
that much,
akcentem, żeby nie
but I would
przedłużać,
like
bo na
to
pewno
close
będą
on
jakieś
an
pytania.
optimistic note,
W
because I
marcu,
believe that many
bodajże
questions
pod
will
koniec
follow.
lutego zeszłego roku,
March,
skierowaliśmy z
perhaps at the
grupą
end of
posłów
February
takie
last
pismo do
year,
premiera
together with a group
Mateusza
of MPs,
Morawieckiego,
we
żeby
wrote a letter to
zafunkcjonowała
the Prime Minister,
współpraca
Mr.
międzyresortowa.
Mateusz
Chodziło o
Morawiecki
resort
for intrasectorial
wtedy
collaboration.
zdrowia,
We meant
edukacji
here the
i
Ministry of
polityki
Health and
pracy,
Education
dzisiaj
and
rodziny,
also
pracy i polityki społecznej.
social
Do tej pory nie
policy
uzyskałam
today,
odpowiedzi.
family and social
Pan
policy. So
Mateusz
far,
Morawiecki
I
już
have
nie jest
not
premierem,
received
natomiast
any
ta
response to that.
współpraca
Mr. Mateusz
międzyresortowa stała się
Morawiecki is no
faktem.
longer the Prime Minister, but still the
Półtora tygodnia
collaboration
temu
has
minister
become a fact.
Nowacka, minister
A
Agnieszka
week and a half ago,
Dziemianowicz-Bąk
minister
oraz
Nowacka, minister
wiceminister zdrowia Wojciech
Dziemianowicz-Bąk and
Konieczny
the deputy
symbolicznie
minister of health,
zapoczątkowali tę
Wojciech
współpracę
Konieczny,
międzyresortową. I
started
dlaczego
the
ona jest ważna i dlaczego
intrasectorial
wtedy o nią
collaboration.
prosiliśmy?
Why did
Dlatego,
we
że
ask for such a
nie
solution?
damy rady walczyć
Because
o
we are
zdrowie
unable
psychiczne dzieci i
to
młodzieży,
fight for the mental
a ten
health
kryzys dosięga
of
co
children
najmniej
and
10%
adolescents, and this crisis
dzieci
affects
i
at
młodzieży w
least
Polsce. To są dane
10%
naprawdę
of
uważam
children and
optymistyczne.
adolescents in Poland. By the way, I
Jeżeli
regard
nie,
these data as
nie
highly
będziemy mieli
optimistic
współpracy
and
na poziomie różnych
understated.
służb,
So if we
od
do not have any
lokalnych
collaboration
samorządów,
on the level
przez pracowników
of local
pomocy społecznej,
governments,
którzy bardzo
social
często są
workers,
pierwsi,
who
mogą
are
pierwsi
the
zareagować
first
na
to
kryzys,
react and they
przez
can
pracowników
stop
ochrony
the
zdrowia,
crisis. Also
pielęgniarek w
healthcare
szkołach,
staff,
bo to nie
school
chodzi tylko o
nurses.
psychologów,
It's
tak?
not
Bo to
only
nie
about
chodzi o to, żeby
psychologists.
nauczyciel nagle
It's
stał się
not
psychologiem,
only
ale chodzi o to, i w to
about
też
a
chcemy
teacher
inwestować, żeby
becoming a
nauczyciel już w
psychologist
procesie
once,
stawania się
but
nauczycielem,
a
wychowania się,
teacher
był
who is going
doposażony,
to be
wyposażony w
educated to
wiedzę.
become a
I o tym
teacher should be
rozmawiamy z
equipped with
Ministerstwem
knowledge, and we
Szkolnictwa,
talk with the
Nauki i
Ministry
Szkolnictwa Wyższego,
of Higher
umiejętności
Education
reagowania na
and
kryzys.
Science.
Jak
They
mówić
need to
do
be
dzieci
able
i
how to
młodzieży,
react to
jak
crisis, how
reagować
to
na ich
speak to
potrzeby
young
emocjonalne.
children, how to
I
react to their
również
emotional needs,
deklaracja
and
minister
also
Nowacki,
the
minister
declaration
Leszczyny
of
o
Minister Nowacka, the
położeniu
Minister of
nacisku
Education, and
na
Minister
edukację
Leszczyna
zdrowotną,
of Health.
na edukację zdrowotną,
There should be
holistyczną,
a
od
lot of
naszego
emphasis light on holistic
ciała,
education,
tak?
of
Chodzi o
health
zdrowie
promoting
psychiczne, o zdrowie
education.
fizyczne,
It's about
tego, jak
physical
jemy,
and mental
jak
health,
czujemy,
what we
to
eat
wszystko
and how
po
we
prostu,
feel as well,
miało
so that everything
sens,
should be
więc,
integrated.
te wszystkie działania, które
These
podejmujemy,
all
środki,
actions
które
that we
uzyskujemy,
undertake,
współpraca z
the
WHO,
all resources that
również,
we have access to,
współpraca z
for example,
UNICEF-em, z
the
którym też mamy program
collaboration
doszkalania
with UNICEF
1100
and WHO.
nauczycieli,
Within this
specjalistów.
collaboration,
To
we
jest wiele
train
działań i
1,100
rzecz,
specialist
bo to nie było
teachers. And
zwyczajem
last but
poprzedniego
not
rządu.
least, because
Bardzo
this
szeroko
was not
zakrojone,
the practice of the
otwarta
previous
współpraca z
government,
organizacjami pozarządowymi
open
oraz
collaboration with
związkami
NGOs
zawodowymi. Ja z pełną
and trade
odpowiedzialnością
unions.
mogę
It
powiedzieć,
is with
że
full
wrota
responsibility
Ministerstwa Edukacji
that I
zostały
say
szeroko
that
otwarte
the gates of
dla
the Ministry of
NGOs-ów,
Education
dla
are
związków
widely
zawodowych
open
i
for
spotykamy
NGOs,
się
trade unions,
non-stop,
and we keep
codziennie
meeting
i
all the
mam taką
time,
nadzieję, że te wszystkie
every day,
działania
and I do
przynoszą
hope that all
wraz
these
z
actions
potężnym
will
budżetem na zdrowie
bring
psychiczne
measurable
dzieci, młodzieży i
results
dorosłych, bo te
together
środki
with
są
the
zagwarantowane
huge
w budżecie,
budget that is
przyniosą
guaranteed
wreszcie
for the
efekty,
healthcare
ale to
of
będzie długa
children
praca,
and
w
young
której
people.
musicie nam
But I'm aware that
pomóc.
it's a long process and we need your support.
Thanks a lot, Paulina, for giving us a little bit of hope also from the side of a responsible government finally in place. Exactly after this session we will have one on mental health, and I see already plenty of experts on mental health here, so I'm quite sure that some of you would like to fire some questions to the Deputy Minister, but if you don't mind, we have the second intervention as well, and then we collect some questions for them to respond. So, come up with a question, frame it, but hold it for a second, because we are very happy to have here with us today Vytenis Andriukaitis. At the moment, he is the World Health Organization Special Envoy for Europe, but he had a big responsibility in Brussels as European Commissioner for Health and Food Safety, plus a track record of being a leading social democrat in his own country, in Lithuania. Thanks for flying here from Vilnius. And personally, I take this as a commercial break from the Foundation European Progressive Studies with Andriukaitis. Under his leadership, we wrote quite a nice book on.
Mihaly Kokeny, one of the authors of this book, and we presented 3 parts of our book. First of all, fundamentals of a European Health Union. Because we all know to have something to discussing. If we are discussing understanding about, we need to have some fundamentals. And second part is main avenues of pan-European cooperation forward. Those avenues are now. Now, you see avenues related to crisis, to pandemic management, crisis preparedness, health technologies, digitalization, and innovations, universal health coverage, rare diseases, and cancer, European Cancer Plan, Europe is beating cancer, equal access to healthcare workers and workforce, and also external dimension. But it is not enough. We see now only 5 programs in Europe, proposed from European Commission side, but those programs, are in hands of member states. And if you ask member states how they are dealing with those programs, you can see very complicated picture. And then, of course, our third part is policies of transition towards healthier and more socially inclusive Europe. Next slide, please. You know, when you ask ourselves why health is far from attention in political debates, but the figure shows, if you compare how many employees are working in health sectors, you can see, in agriculture, forestry and fishing, mining and quarrying, manufacturing of basic figure shows down. Health and health sector and industry, health industry is going up. Health economy plays important role in the European Union, but it's far from attention when you are speaking at debate. Please, next slide. Next slide, please. Next slide, please. And if you see public opinion, one prominent issue that concerns Europeans is health. And you see a big gap between political debates and public concern. Big gap. They strongly desire the EU to address public health matters and effectively respond to future health threats through a unified European policy. Recognizing the magnitude of this task, Europeans understand that achieving such a policy would necessitate amending treaties of the EU. Next slide, please. And therefore, we envision the following set of criteria as parameters that would determine the eligible areas of EU actions. One of them, when a member state is overburdened with the issue at hand. And all member states today are overburdened. All. Of course, second, cooperation between different member states on an issue brings added value. Please ask ourselves how Poland is cooperating with Germany, with Lithuania, with Czech Republic, in cross-border area related to all health care issues. What about cooperation in buying some medicine and so on? No one example in reality. All governments are doing on their own. And of course, there are evident consequences to health. And evident consequences we will show. When a health issue causes public distress, pandemic and public distress was very high. very terrible picture. There is a cross-border nature to health issues at hand, and there is a possible, timely, and socially acceptable action at the EU level to address it. We propose those, those criteria. Next slide, please. And of course, we all know that all member states signed, agreement related to Sustainable Development Goals. And number 3 of Sustainable Development Goals is health and well-being. And such health and well-being is interlinked with all other 17 Sustainable Development Goals. Please look into European Council agenda. When they discuss issues about implementation of Sustainable Development Goals at EU level, please ask ourselves. We are voters, we are citizens. Why Sustainable Development Goals are far from attention? And of course, health as a central, as interconnected issue with all other goals disappeared from political debates. Let's next slide, please. And then a very important issue is coverage dimension. And if we are adding service access, you can find population coverage, service access, cost coverage, and you see how many criteria should be included when we're analyzing, service access, access to healthcare. But when you are asking member states about their, data, how they can provide data related to access to healthcare, keeping only one aspect, access to primary healthcare, for example. And if you can find, nothing serious, only going through the scientific assessment, you can find some data. But if you look into Eurostat, the health data disappeared. As if better data are a prerequisite to inform policies, the ultimate goal is to fulfill the commitment to ensure access to health care expressed in Principle 16 of the Pillar of Social Rights. Pillar of Social Rights, Principle 16 is access to affordable health care and so on and so on. And what we have now in our real political life, nothing. And enhancing solidarity, equity of health coverage in the EU should be the overarching objective of European Health Union. It is an ongoing challenge requiring strong involvement and coordination of all member states. Let's go to the next slide. And of course, I can show only one example, rare diseases. The name rare diseases is misleading. We have in European Union 32 million people suffering from rare diseases. 32 million. We know that about 7,000 rare diseases. From them, only 1,000 should be treated now because we have a lot of work from scientific point of view. But if you ask access and diagnosis and treatment of people with rare diseases, you can see no one country is capable to deliver treatment to patients with rare diseases. No one. Starting with Germany, finishing with Lithuania. Why? Because lack of capacities, lack of knowledge, lack of financial means, and of course, and so on and so on. Much work has been done to tackle rare diseases, but even greater challenges lie ahead of Europe. Only when patients no longer have to wait for 5 or 6 years to get an accurate diagnosis. Diagnosis odyssey is average about 7-9 years, only speaking about diagnosis. When high quality, effective, integrated and coordinated treatments are given to at least 95% of patients, now only 5%. When patients and their families become happy and fully integrated members of our society, only then we will have the right to say that we did not leave no one behind. Our slogan is, leave no one behind. Or what about vulnerables? Underground people and so on. Its slogan is far from reality. Let's go to the next slide. And you can see now also terrible issue with healthcare workforce shortages. Now it is ticking bomb in the EU. And now it's number 1. Because we see now at this moment, we have lack about 3 million doctors of general practitioners, and we have no chance to deliver health care because we have lack of nurses. About 6 million nurses we need now, this time, addressing shortages. Who is speaking about those issues? Not no one. Of course, Commission recognition of the problem in the EU care strategy. I know that you just presented EU care strategy and explicit mention on territorial gap in the proposed recommendations. Affordable long-term care can be seen as a prudent first step, but we need to say health care workforce shortages in Poland, in Lithuania, everywhere. We see areas with medical deserts where around 20 kilometers they have no fund, nothing. No nurses, no general practice, and no pharmacies. And concentration in big cities and in big territories are, in public services disappeared in many, many regions. Let's go to the next slide. And of course, speaking about treatable and preventable mortality, because it shows really which gap exists between Eastern and Central European countries in the EU and Western countries. The divide in health status between Western and Eastern parts of the EU is far from being closed. We are now more than 20 years in European Union, but such gap is still there on the ground. All countries with figures below the EU average are from Central and Eastern European countries. Health status improved a little bit, but if you look after pandemic in 2020, an increase of treatable and preventable mortality in comparison to 2011 was recorded in Bulgaria, Poland, and Romania. It was statistics. The reduction of treatable and preventable mortality in Central Eastern European countries to the level of the EU average would save us up to 150,000 lives per year. You need to say that health for all should be one of the main goals of our governments and our councils. Let's go to the next. And of course, compare our budgetary means, Now, we know that now we have 5.3 billion euros. But even after this substantial increase, the budget will not exceed 1% of total annual public health expenditure of the EU member states. So many, so small amount of money now. Please, next slide. And generally speaking, next slide, please. Generally speaking, we are also speaking about European Union budget. Please look. European Union budget is this one. If you compare with all gross national income of all 27 member states, you can understand why we need to speak about our necessity to discuss about European Union future. We are ready to invite Ukraine, Moldova, Georgia, and Western Balkans into EU, having this 1% of European budget? Absolutely impossible. We need to discuss possibilities. How can we, do more addressing issues with very small budget? Let's go to the next slide. And of course, European treaties. European treaties are very weak on health. Health is not in the preamble. Health is not in the Article 3. Treaty on the Functioning of the EU is prioritizing articles to devote it to the development of internal market against the articles dealing with other activities of the European Union. Development of health is considered necessary to the Union insofar as it serves better functioning of internal market. Health is not an aim. It is only a palliative measure. Current health union-related initiatives are not tackling about health as specific objective of the EU. The talk is about a well-functioning internal market generally. And those proposals were based also not on Article 168, on Article 114 and other articles, because they allow the Commission to propose some measures. Legal, fiscal, political limits of stronger health policy enshrined in the treaties do not allow EU to act in a more effective way. Next slide. Pan-European cooperation can create added value in pan-European goods in health. Now we are proposing a concept, public goods. European citizenship and public goods. Local public goods, national public goods, and European public goods. And public goods in health are so clear example why we need to push forward idea about European Health Union as social and health well-being union, which should include public goods into European policies. Most actions in health require involvement of governance at national level. They should take decisions and action when the objective on action cannot be sufficiently achieved by the member states, but can be better achieved at EU level. Member states and the EU have stakes in development of European and global public goods, and of course shared competences. And we need shared competencies speaking about pandemic issues. We need shared competencies speaking about the treatment of rare diseases, treatment of complicated cancers, treatment of multimorbidity and so on. It is not. It is, for me, it's evident. Next slide. And we propose in our book 3 scenarios, and we are asking now you all to advocate those 3 scenarios. We need to do more using instruments which we have. Is scenario A, measures to make progress in health concentrate on what can be done with existing legal, financial, and managerial instruments, upgrading already functioning institutions and improving implementation of already agreed policies, especially keeping in mind those 5 programs. Second, the development of secondary legislation and establishment of new institutions that are supposed to create added value in parallel to fine-tuning of existing instruments of health policy. And those scenario A and scenario B do not require treaty changes. It's required only to activate our efforts to keep health high on the political agenda. But scenario C requires treaty changes. Next slide, please. And moving forward with European health, with genuine European Health Union, we need to enshrine health into preamble of Lisbon Treaty. We need to stress and enshrine in Article 3 sentence, each shall promote universal health coverage by establishing a health union, and we need to include and to rewrite Article 168 of Treaty on the Functioning of the EU. And finally, final sentences, next slide. But first and foremost, the momentum and the sense of urgency must not be lost. It is critical that our efforts to promote a strong European Union should be strengthened in front of the June 2024 European elections, and will mark the start of our activities to include the European Health Union concept into a new mandate of the European Union institutions. We would do well to remember that in this difficult time, the EU is one of the few global actors committed to democracy, human rights, rule of law, multilateralism, and health is fundamental human rights, and we need to act, and we need to be very strong advocates proposing genuine, strong European Health Union. Thank you.
Thank you, Mr. Andriukaitis, and thanks to the operators here in the room for capturing the dynamic movement that we had, so that also the people online could follow this passionate intervention, basically almost a complete agenda on how to put health as a priority. It's now the moment, even if we are a bit late, to get some of your inputs. I'll pass you the microphone for your comments and questions. Perhaps you can come here so also online is.
Yeah. So good morning. My name is Mihai Kökény. I came from Hungary, and I have some political experience and working with WHO and EU as well, and I am very glad being here as well. So it's very hard to say anything after such a fantastic introductory comments and with the visionary statements by my friend Vytenis. However, I would like to raise just one issue for your kind consideration. The comments from Paulina Pechina-Wieckiewicz, I hope it was right enough I can't say too much in Poland. Your comments should remind us that health is not only the responsibility of one dedicated ministry. And I would hardly imagine any other sectoral policies without a health impact. Think about agriculture, think about education, think about transport or whatever. So therefore, health, I think, should appear as a whole of governance mission, demanding coordinated efforts from the complete governance infrastructure. And WHO is advertising this for a very long time. But what about the European Union? We had a Finnish EU presidency in 2006, which tried to represent the so-called health in all policies approach, but there were not a real continuation in the subsequent rotating presidencies of this approach. Maybe, and I would like to join witness, time has come to recall the health aspects of all other policies, whether it is about the antibiotic use in agriculture or the health consequences of climate change, to incorporate, that type of spirit, that type of thinking when we try to push health higher on the political agenda. This conference is called Health for All. So maybe there should be a next conference, Health in All Policies. Thank you.
We like very much the suggestions. Other questions or comments? Please.
Ja sobie pozwolę mówić po polsku,
I
jeśli
will
mogę.
be speaking in Polish, if I may.
Dziękuję
I will
bardzo.
be speaking in Polish.
Jerzy
Thank you.
Przystajko, Partia Razem.
My name is Jerzy Przystajko and I represent Razem
dużym
Party,
zainteresowaniem
left-wing
słuchałem
party.
tej
It was with great interest
emocjonalnej
that I
przemowy.
listened to this highly emotional
I
and
aspekt, który
passionate
myślę, że warto
speech.
poruszyć
And the
tutaj,
aspect
to jest
that we should
brak
discuss
profesjonalizmu.
here is the lack
Ochrony
of
zdrowia.
professionals in
Ja z zawodu
healthcare.
jestem farmaceutą,
I'm
także
a pharmacist
znam
by
to
education
też od
and by
powszechni
profession.
polskiej,
That is
ale
why I
myślę,
know
że
this
warto by
very
wybrzmiało
well.
to, że
But I would like
systemy
this
ochrony
to
zdrowia w całej Unii
resound
Europejskiej
strongly that the problem of
powstawały
healthcare
pewne
in the
założenia
entire
też o podziale
European
pracy
Union
między
have
zawodami.
always existed.
Co robi lekarz,
Also the
co robi
issues
pielęgniarka, co robi
about the
farmaceuta.
division of work. What
To
is the
wszystko
scope of
kształtowało się
competence of
jeszcze
a
w czasach
doctor,
feudalnych.
nurse and pharmacist?
To jak to
It was
widzimy, jeszcze
created
w tym
in feudal
wyobrażeniu,
times.
co robią mężczyźni, co robią
In
kobiety,
our
jak wygląda
imagination,
ta
what
rola
are
dobrego
men's
cesarza, którego
work and
łaska gdzieś
women's
tam spływa
work,
w dół.
and what is done
I
by feudal
trochę
authorities
mi
whose
brakuje w tej
grace is
dyskusji
transmitted somewhere lower.
wykorzystania
So
potencjału,
what
jaki
I
drzemie w
think that this
zawodach,
decision
nazwijmy to
lacks
zawodach
is the
nielekarskich.
use of the potential
Bo
of non-doctors
Tutaj dochodzimy
professions.
do takiego punktu, cały czas
So
rozwijamy
professions
taką,
related to healthcare, but
taki
not
brak.
executed by doctors. So
Być
there is
może
a lot of
moglibyśmy
lack
zacząć
here
czerpać nawet
because
z
we could
doświadczeń
really
afrykańskich.
benefit from
Tam
the experience even of
niedobór personelu jest
Africa,
tak
where the
ekstremalny,
shortage of
że
medical
to
staff is
przenoszenie
so
zadań,
extreme
to
that the
ta zmiana podziału
communication or
pracy, zmiana podziału
delegation of
władzy nad
tasks,
procesami
the
w
change
systemie
of the
ochrony
division
zdrowia,
of power
ona
and
przybiera
authority
też
over many
ekstremalne
processes
formy,
in healthcare
bo jeżeli
goes
w
to
kraju po prostu nie ma
extremes,
w ogóle
because
lekarzy i
if there is
pielęgniarek,
no
to szuka się różnych
doctor, there are
rozwiązań,
very few doctors in a
które
country or
pozwalają
very few
chociaż
nurses.
część
People start to look
procedur
for
wykonywać
solutions
na przykład
which allow
przeszkolonym,
some of the procedures to
no,
be
może to
carried
jest złe
out
słowo,
by
ale laikom.
well-trained lay people.
W
Or
Europie
perhaps it
mamy
is not the
wielką
appropriate term.
różnorodność tego
In Europe we
przenoszenia
have a
zadań,
great
task-shiftingu. Komisja
diversity of
Europejska
task
też
shifting.
dostrzega ten problem.
And the
Chociaż
European
wypowiada
Union
się
is
tutaj
aware of that.
bardzo delikatnie, bo to
And
wywołuje
obviously,
emocje, bo
European
to nie jest
Union
tylko
is
rozmowa
slightly
o
conservative here because it is not only a talk
takim
about
merytorycznym
the
przenoszeniu zadań, jak to robić
essential task
efektywniej,
shifting,
bo
how
gdzieś
to do it
ustaliły się te podziały
effectively,
zadań, podziały
but
pracy i
also some
porusza się
work
to taką
divisions were
bezwładnością, że
solidified, and
zawsze
it
tak to
moves with some
robiliśmy
inertia
i
that we
może
have
powinniśmy
always
robić
been
to
doing
nadal,
it, and we
ale to
should keep
przemyślenie,
doing it.
odblokowanie tego potencjału myślę, że jest
The
pewną odpowiedzią
full
na to, jakie
use of
mamy
the
braki personelu w
potential
Europie.
would be
I
the
myślę, że
appropriate answer to the
włączenie
shortage
tego
of
do
staff
unijnej
within the
polityki
European Union,
jako
and
pewnego
therefore
obszaru
the inclusion
i później
of this
zharmonizowanie
into the
tego
European
wśród
Union
krajów
as
Unii
appropriate
Europejskiej
area and
byłoby wielką,
harmonizing
wielką
it
wartością.
within the
Dziękuję
EU would be a great added value. Thank you very much.
If there are no other pressing questions, you have basically we give you 1 minute and a half each, if possible, to try to respond to these two inputs on labor shortages and maybe the integration of health services within the government.
Ja właściwie trudno jest mi
Basically, it's hard
nie
for
zgodzić
me
się z przedmówcami, więc
to,
mogę tylko skomentować, że
not
popieram.
to disagree
Jeżeli mogę
with the previous
tę minutę na
speakers,
dodanie
so
jeszcze
I will say I agree,
kwestii
and let me
do
just add
polskiej
a
szkoły,
few issues
to
to
chciałabym wspomnieć o
concerning
jeszcze
Polish
jednym
school.
ministerstwie,
So let me
bo to
mention
jest
one
bardzo
more
ważne
ministry,
wyzwanie dla
which
nas
is by all
wszystkich. To jest
means
Ministerstwo
important.
Cyfryzacji,
This is the
którym,
Ministry of
zarządza,
Digitalization, which is now
wicepremier
managed
Krzysztof
by the
Gawkowski.
Deputy
Chodzi o higienę
Prime
cyfrową.
Minister
I chodzi
Krzysztof
o to,
Gawkowski.
po
It's
pierwsze
all
o zdrowie
about
psychiczne
digital
dzieci i młodzieży
hygiene,
w
mental
necie,
health of
a po drugie chodzi o
children and
bezpieczeństwo
adolescents
dzieci
in
i
the
młodzieży
internet and their
w
safety.
necie, więc to
Also
jest
their
bardzo ważna
safety
rzecz,
in the
o
internet.
której chciałam
So
powiedzieć. Druga ważna rzecz, o
this
której
is an
chciałam
important
powiedzieć,
thing,
to
and the second important thing
zwrócenie uwagi
is
bardzo
that
mocno na
we
przemoc
should draw your
rówieśniczą,
attention to
na to, co
peer
dzieje się w szkołach,
violence,
bo ja mam te
what's
doświadczenia,
going on
że
in
dzieci
school,
z oddziałów
because
dziennych
I see
szpitalnych,
that
dzieci z
children
oddziałów
in
stacjonarnych szpitalnych
outpatient
często są
hospital
ofiarami
wards and
właśnie przemocy
inpatient
rówieśniczej,
hospital
trafiają
wards
na oddział, a potem
frequently
wracają
fell
do szkół,
victim
w
to
których ten
peer
problem nie
violence,
jest
and they
rozwiązany. Z
return
tym
to
również
schools
chcemy
where this
bardzo mocno
problem
walczyć,
is
żeby wiecie,
unresolved.
oddziały
So
stacjonarne są
I
bardzo
believe
potrzebne do
that
diagnozy,
obviously
ale nie mogą być
inpatient
safe
wards are
space'em dla
necessary,
dzieci
but they should
uciekających
not
przed
be the
przemocą
safe space for children who
rówieśniczą,
try to
I
escape
to jest
peer
druga
violence.
sprawa, a trzecia
And
sprawa,
this is the
wątek
second issue,
wypalenia
and the
zawodowego
third issue is the
pracowników
professional
zawodów ochrony
burnout
zdrowia na
problems
pewno,
of
ale
many
w oświacie
healthcare
również.
workers,
To
but
znaczy
also
polscy nauczyciele
educational
są
workers.
wypaleni
Polish
zawodowo,
teachers
nie są
are
w
burnt
stanie
out,
pomóc
they
sobie
are
bardzo
unable to
często,
help
tym bardziej nie
themselves,
są w stanie
and all the
pomóc
more they are
dzieciom i
unable
młodzieży, którymi
to
się
support children
opiekują.
and
I to
adolescents
jest
that they are
trzeci
looking
temat,
after.
to jest bardzo ważna rzecz, o której mówimy w ministerstwie,
This is
którą
the
chcemy się
third
zająć.
subject, and
I
this is
czwarta,
the thing that
najważniejsza.
we hear
Oświata to
mentioned
nie
in the
tylko
ministry.
edukacja. Oświata to również
So
wychowanie,
teaching is
to
not
wspieranie
only
rodziców w
education, it
procesie
is also
wychowawczym.
bringing up and
Rodziców, którym nie
supporting
zawsze
parents
starczy. Sami o
in
tym
bringing
mówią,
up
kompetencje
process.
rodzicielskie.
Frequently
Musimy im
those
pomagać
who
i
lack
wspierać.
some
To
parental
również
competences,
profilaktyka
they admit
zdrowia.
it. Also,
I
this
stąd
is
ta edukacja zdrowotna, o
prophylaxis,
której
health
mówiłam. Więc ponieważ
prophylaxis.
zgadzałam się z
So
moimi przedmówcami
because
uwagami,
I
to pozwoliłam
agreed
sobie
with
tylko
previous
dodać
speakers,
parę
I just
wątków.
wanted to
Dziękuję
add
bardzo.
some issues which were not touched upon.
Thank you so much. I fully agree with you and with your intervention. And of course, we are here like-minded, from my point of view. And speaking about possibilities to integrate all sectors, starting with pharmacists, finishing with technicians. We need to understand now we need to use much proper integrated way our resources in front of shortages. And of course, pharmacists can play enormous role in providing primary care, for example, vaccination and different issues. Pharmacists can do a lot in areas where the general practitioners do not exist. And we need to use such resources in very integrated manner, for sure. And of course, also, once again, now as never is important to understand multi-sectorial management of health services. Patient should be in the center, but teams around the patient should be built as team building, including pharmacists, general practitioners, specialized medicine, all team building. We need to understand that now team building approach is a main goal to provide much more effective access to healthcare and of course, but we need to keep in mind that today when we are speaking about health, we need to understand that we are speaking about many, many issues related to European Union future. And in the treaties, you can, what is lacking in the treaties? Health and well-being pillar. Social pillar is not as an aim of European Union. It's only an ancillary issue. And we need now to start discussions about treaty changes. And I am very happy to have such book, EU treaties, why they need targeted changes. Is excellent policy paper in proposing new approach based on European public goods, European citizenship, and democracy. I ask you to draw attention about this very excellent paper because it covers all topics, including new stage of development of the EU as health and well-being EU. And it is main message from my side.
Thanks. I think it's difficult to galvanize the population on treaty change, but it's good to keep it alive as a topic before the European election. With a little bit of delay, I'm very happy to pass the floor to Monica Elak for the moderation of the next session on mental health. And I would like to thank Konrad Golota that just reached us from the cabinet. He's head of cabinet of the Deputy Prime Minister and also in charge of digital policies so that we continue really this conversation to see how health is an integrated issue. And thanks to the new Polish government to approach it in this manner. Monica, you have the floor, and please clap your hands again for our speakers.
Thank you, David. As it was said, I have a pleasure to moderate the second panel called Addressing Mental Health Crisis in Europe. And as you can imagine, this is, let's say, out of, well, maybe it's not the most fortunate word, but hot topic right now. And rightfully so. We have actually plenty of people invited to speak about the issue since it's very complicated, complex, and needs policies that are complex to actually seek proper resolutions. So let me start with introducing our panelists. First of all, we will start with scene setting. And first to speak will be Tomasz Petriczek, who is director of the Progressive Center and former Minister of Foreign Affairs in Czech Republic. Yeah, please welcome. Who has also many other affiliations, and during his work he also tackled the issues of social policy. So later we will hear more about Manifesto on Mental Health, among other things. Also with the scene setting will help Andrzej Kłoda, who is a mental health practitioner, psychiatrist, therapist, head of the Mental Health Center based here in Cieszyn. Welcome. These two will be our first speakers. And then we will move to the discussion panel, and then I will introduce the rest of the panelists. So here you go, floor is yours.
Thank you. Good morning. First of all, I would like to thank you for the invitation. And as to set the scene, I would like to highlight the fact that mental health has been present in European policy debate for more than 30 years. Actually, the first reference to mental health in the Council conclusions you can track back to 1996. Already in early 2000s we are speaking about there is no health without mental health. But true is, and as Monica mentioned, mental health has become a buzzword with COVID pandemic, and with the current polycrisis we are facing, from war in Ukraine, inflation, energy crisis, and other crises that affect well-being and mental health of European population. In fact, the recent last autumn Eurobarometer shows that 82% of Europeans clearly link mental health with overall health. For 4/5 of Europeans, mental health is inseparable from health, their individual or community health. It is not surprising, therefore, that the European Union has reacted over the past couple of years to the mental health crisis. I think there is a general consensus that we are facing an increasing problem in this field. And the Commission, first of all, launched it as a priority. Ursula von der Leyen in 2022, for the first time, mentioned mental health in the State of the Union speech. And last June, the Commission presented a comprehensive approach to mental health, a communication that set a scene for new policy approach of the European Union to the area. However, I think that there is still a lot missing from the general picture, and for us progressives, it is clear that we need to push for more comprehensive and innovative mental health agenda in the next 5 years after the European elections. That leads me to the idea of progressive manifesto, and I would like to highlight 5 key issues. I think that for us there is still a little done on the issue of mental health in the workplace, mental health and well-being in the workplace, from issues like reporting on mental health. Companies should start reporting what they do for their employees in terms of well-being and mental health, tackling mental ill health from depressions, work-related stress factors, addictions, and so on. Second, it has been already mentioned, I think that there is a need to have a more innovative approach to mental health in digital era. Both in terms of how to tap the potential of new technologies in terms of assistance to people that are suffering with mental ill health, but also to address major challenges new technologies are bringing for our mental well-being. Let's be honest, there is a still underestimated impact of digital technologies, social networks, in relations to addictions, social isolation and social isolation related depressions, and other serious mental health states. And we need to focus in particularly on the most vulnerable here. Third, I would like to stress, and that's what we feel is missing from the overall picture, still a link between the problems of addictions and mental health. These comorbidities, issues related to how addictions worsen most of the mental ill health issues, and vice versa, how mental well-being, lack of mental well-being very often is one of the reasons for emergence of addictive behavior. So I think this is another area we need to focus much more. The fourth priority we see in area of reintegration after recovery. I haven't mentioned it so far, but there is still stigma associated with mental health issues, and especially in the most vulnerable groups. And first, it is an issue when it comes to treatment, or prevention and treatment, but even when it comes to integration of people who went through the treatment, recovered, and now they need help with integration back to the society. A lot of people still face a lot of barriers in terms of reintegration. And last but not least, and this is what I feel is a cross-cutting issue, is the question of addressing root causes of many mental health issues, and I think that's where progressives needs to be very vocal, and it is the issue of addressing the vulnerabilities, the relationship between marginalization and mental health, addressing socio-economic factors that play enormous role in emergence of mental ill health, issues such as, for example, housing related stress, the fact that for many young people the issue of housing creates a lot of stress, further contribute to their well-being, or rather lack of well-being, and it increases the potential of emergence of mental ill health. So this is something that goes through all priorities. We need to address and focus in particular on social groups that are facing marginalization, that are most vulnerable in relations to causes of mental health problems, be it at the workplace, be it in the digital area, be it in relations to addictions, and in terms of recovery. And last but not least, please allow me to conclude. It might be surprising that somebody who is focusing largely on geopolitics and foreign policies is also interested in mental health. But I would like to stress that that we should and we need also to always remember that there is a very strong link between mental health and well-being on the one hand, and the overall social resilience of European Union, our society, on the other hand. Especially in time of polycrisis we are facing, mental health and addressing issues related to mental health is a way how to strengthen European resilience to shocks, to crises we are facing and we will certainly be facing as well. So that's why I think it's also very much related to issues of security, safety and resilience. Thank you.
Thank you. Now let's pass the voice to Andrzej Koda. Floor is yours.
Ja bardzo się cieszę, że kolega Tomasz
I'm
zaraz
very
z zagranicy
glad
mówił przede mną,
that
bo
Thomas has
w
spoken
naszym
before
terenie,
me,
tutaj gdzie Państwo jesteście, w
because
Cieszynie i w całym
here
powiecie cieszyńskim, od
in
samego
Cieszyn
początku
and the whole community
pilotażu
of Cieszyn,
Centrum Zdrowia Psychicznego, działa Centrum Zdrowia Psychicznego
we've
obejmujące
had the
opieką
Center of
wszystkich
Mental
dorosłych
Health
mieszkańców
that
tego terenu.
covers all
Jest to program, który
adult
został wprowadzony dzięki
citizens of this
porowi
area,
ministra
and it's
Balickiego,
a program that
ale
has
też
been
wielu
introduced thanks to
specjalistów
Minister
z
Balicki,
Polski, którzy
and also
zauważali, że
very many
opieka
experts from Poland who have
psychiatryczna
noticed that
skoncentrowana na dużych szpitalach,
psychiatric
ewentualnie poradniach jest
treatment that is
niewystarczająca.
provided by
I
council
po 5
facilities and
latach
hospitals
naszej pracy,
is
też obserwacji,
insufficient.
wiemy właśnie jak bardzo
After
skomplikowana
5
jest ta
years
opieka, ale
of
też jak bardzo
running this program,
wpływa
we've seen
na
how complex
właśnie
this
dobrostan i
care
jakość
is
funkcjonowania
and
naszych
how
pacjentów.
it influences the well-being and the
To, co
functioning of our
ten program nam
patients.
gwarantuje, to
Now,
to, że
what
my
this
tutaj
program
na miejscu
guarantees
wybieramy
is that it is
najlepsze
here
formy dla
on
naszych
site
pacjentów.
that we can choose the
Czyli
best
mamy budżet powierzony,
forms
mamy odpowiedzialność
of
terytorialną
support for our
i
citizens.
ci
So
pacjenci
we have
lepszy,
budget,
zdecydowanie lepszy
we
sposób są.
have this local governance, and I believe that patients receive better treatment this way. What we lack is broader collaboration, and we've heard here that, there's going to be collaboration at the governmental level between the ministries. But I also believe that there should be, for example, collaboration between doctors and employers, so that employees, after treatment, they can be reintegrated at the workplace. I always, when I saw my patients who would like sit around the table and draw something,
I always thought that, okay, they're fine here, but then they have nowhere to go. It is important that the patient who undergoes treatment then can have rehabilitation and also have the sense of being necessary in society. Now, from a historical perspective, I could say that we have undergone 2 or maybe 3 revolutions. One of them would be going from the socialist system to the free market system. The second revolution was the technological revolution, and the fact that young people, but also us, well, we all have mobile phones which are recorders and cameras at the same time, with which we can read emails and so on. So suddenly we have something that we haven't had for thousands of years. And I believe that we are still animals that need a herd, that need to be understood, that need to be that need good touch, and we now communicate through mobile phones. We also see, being here in the borderland, that we are an international community, because after all, I live in Poland, but I have a family in Czech Republic. I also go to Slovakia to see my friends. And so this global world is closer to us, but in a way, the values have changed, the institutions have changed. If we think about this, for 2,000 years, the church was a kind of institution that would be untouchable. And now it leaves the scene in a way, and this place is taken by psychiatry. I'm a supervisor of therapists, so I supervise psychotherapists, and I have this impression that when I do this, I come to different churches. So there are psychotherapists who are gathered within one school, and they have different bishops. Each of them say something different, but I believe that our population needs a kind of leader. Maybe what I'm saying is too acute, but I believe that we are really not so much different from our predecessors who lived here 200 years ago. Yes, we have different possibilities, opportunities, and gadgets, but something that we keep forget in our times of technology is that we all need closeness, communication, a talk. And lack of it cause our crisis. Now, let me refer to the church again. Now, diagnosis that causes fear. Memento mori. Remember that you're going to die. So first it was proclaimed by philosophers, then the church did that, and now medicine does the same. What is important is that we communicate to people many issues, including health issues, in a sound way, so that we don't cause fear, but we give support. Now, I saw this slide showing us that there's a growing number of health professionals, and I can compare it to the number of employees that there were 10 years ago, and now I have this group of 160 collaborators who work with patients at the mental health center, and I believe that the trend keeps growing. So how to be with another person, how to communicate with people, how to guide them so that they can return to society, well, it's important. I could speak for hours. Now, I also agree with one more issue here. Well, since we are here in the borderland and in Czech Republic, they are more lenient on using marijuana. Okay, in Poland it's an issue, so I don't recommend doing it. But there's this trend among young people, young adults, in looking for substances that can help them function better. Now, when I think about my patients, it's hard for me to think about those who don't look for such substances. And unfortunately, this makes looking after their mental health much more difficult.
I will ask you to stay on the stage but sit on the side for the purpose on the Q&A later, and also if you have, and if you have later, during the discussion, anything to add concerning, all the answers of our panelists. It will be also nice to also to add something. So thank you. For me, what you were saying was mostly about, if I can very generally summarize, about the integration of the issues of mental health into everyday life, and also very basic human existential problems that we all encounter during forming relationships, during work. And basically this is something I would like to start the panel with. Before I introduce the rest of the guests, I will just say that we started with scene setting and short speeches. Now we are moving to the debate. And the end of this debate, we also shall have some time to have wider discussion. So whether any of you would like to have a question or comment or remark, there will also be time for that. And now I would like to welcome our three panelists. First is Natalia Kallio. Welcome. Natalia is a board member of European Youth Forum, but also a human rights advocate and activist, and she will provide the perspective of the young people towards mental health today. Also, I would like to introduce Tomasz Szafrański. Welcome. He is the head of Department of Psychiatry in Lazarski University, and also in the Wolski Mental Health Center in Warsaw, and also the president-elect of Polish Association of Community Psychiatry, and also mental health practitioner. Also we'll speak a lot about his professional experience. And also, last but not least, Sara Bojarczuk. Welcome. Sara is a sociologist by training, and also research assistant professor in the Center of Migration Research at the University of Warsaw. And also writes a lot about mental health policies, so also will provide research expertise on the topic. So thank you all for coming. I am looking forward to this discussion. As we started to talk about the integration of mental health issues. This is something that actually I would like to start with, because when I recall the times, let's say a decade ago, or at least even less, I would say that if this panel happened then, we would discuss more about how to make the topic less stigmatized, and how to help people understand that, for example, their struggles are real, that they have right to seek help. And nowadays, I think that maybe I wouldn't say that it's not a problem anymore, but awareness rose for sure. And more people are vocal about the existence of the topic. Also, politicians, celebrities, journalists, as well as personally, but also as a general topic, they addressed it publicly. So more and more people are encouraged to think about their lives in terms of addressing the mental health issues. In this context, let's say the growing visibility of the problem, and especially after the COVID pandemic experience, would you say that we as a public in Europe, in general, are we in better or worse condition, and why is so?
Thank you. And thank you for the question. I think in general, like, there's more discussion around mental health for sure. There's new roadmaps and set aims, like the Commission's comprehensive approach towards the mental health. But in general, still half of all the young Europeans now report still a poor mental health. And depression and anxiety has doubled in most of the European countries, like throughout these 5 years. Since 2002, there has been some improvement in the mental health in general, but still the young people are reporting the doubled amount of depression and also like reporting higher amount of mental health problems comparing to the older generations, for example. So in the data that we gathered in the European Youth Capital, in the Youth Forum, like we had this Beyond Lockdown report, we gathered the data that 1 in 2 young people are now still reporting unmet needs when it comes to mental health support and mental health services. 1 in 2 in Europe, which makes us a half of the population of young people. So I would say that it's still definitely an issue, and all the statistics are aligned on it. I would say it's a growing issue still, and we are not yet being able to really go into the roots of the problem. We are still really linking the mental health and issue only within the health policies or within the topics related to caring or nursing. We're not seeing it as a political and economic issue as it is. And really, when we're going to the roots, mental health, it's not an individual problem, as we're still like a lot of seeing it like that way. It's a political and economical issue, and it has the roots in the austerity measures, in the financial crisis, in the aftermath of the COVID-19 pandemic. It has the roots in the precarious working conditions, such as platform work or unpaid internships. When I'm like now having the youth perspective when I'm talking. And it's really interrelated with the social aspects, such as financial instability, platform work, loneliness, isolation, housing, and so on. And when we look at it, like in the deeper level as well, I think we really should be focusing, like it was also said in the scene setting, the how do we see and value work in general in our society. Because I think that the deepest roots of the mental health crisis are in the culture and how the culture is valuing and seeing the work. Because how is it that the most valuable works that we have in the society, such as caring or taking the rubbish out or food delivery, are the works where where young people and people in general are in the most precarious working conditions. And work, of course, it should be something that you can, by that you can afford and sustainable living conditions, such as housing, and afford and sustainable and affordable living in general.
Thank you.
Oh, thank you for inviting. And to answer this, maybe I would like to share my perspective as a doctor, because it's almost 30 years I'm working in psychiatry. And of course I agree that it's difficult to say that we solved the problem or that we are in a better condition looking for the mental health problems of the society. But I also feel, unfortunately, kind of déjà vu during panel like this and conferences like this, speaking about the same things over these 30 years and saying a little bit it's like double bookkeeping that we are talking about. Yes, mental health issues are very important. There is no health without mental health. Mental health people are vulnerable and we are leaving them behind. We must do something for them. And then nothing happens, or maybe not nothing, but too little happens. And I also feel that we have kind of waves of interest. Now, thank to COVID and thank to really big problems we had during the pandemic, we started again to think about mental health and to see that's really world problem, European problem of every society. And I hope that it will generate more changes, because somehow these changes need these pushes. And but I also know that it might be that we have not very wide time gap to initiate these changes, that maybe it's this year, and for European Union or changing the policy or making any kind of new policy, soon it won't be a first issue or, you know, first pages and so on. Well, it's important that we are here and it's important to talk about it. But also, I believe that somehow it's important to act on the level of European Union, but also we must remember that mental health is part of, it's just a human right. And if it is a human right, it is an obligation of the state, it's obligation of the government for to act for mental health. And we don't need, in fact, a new treaty, European regulations. We just need them, our governments, to start to do their work. And we need them to ask them, why are you not doing this? It took 25 years in Poland to start this mental health reform. Or even more, but when I started my work as a psychiatrist, it was just a discussion how much we need the mental health, change the organization of our mental health system, and that we must do it now. I remember that when I started my specialization in psychiatry, there was signs of big crisis in child and adolescent psychiatry. It was 25 years ago. We were talking about that we have two less doctors, that this specialization need more prioritization, and but not only the specialization, that there are just, you know, wide gaps on the Poland map where you have no access for specialists in mental health for child and adolescent, for adults too. But somehow it was possible not to see the problem for many years. So what was the crisis became really a big crisis, and thanks God it started the reform we have, which is just halfway. So a lot of things to do. Andrzej just said that thanks to somehow the moment in Polish politics when it was possible to introduce this mental health reform. It was started also here, and that we see that this reform, which follows the rules of community psychiatry, understood as the level of organization of psychiatric care, and this way of organization of psychiatric care which somehow give really opportunity for the certain population, because this kind of organization depends on giving the mental health care for a certain defined population. And it gives opportunity for those people to have good access to service in terms of distance, but also in terms of quality, in terms of, I don't know, 1 hour drive. Is it possible 1 hour drive here in Cieszyn? Okay, but almost possible. Anyway, it's also it's thinking in terms of population. It's thinking and organizing this mental health care in terms of thinking of public health, and it gives this opportunity to get all kinds of psychiatric help we have in psychiatry, and also it, of course, it's in Poland. It means that you will get this help for free, that you have guarantee that you don't pay for this mental health care. So I think it's, of course, it's not ideal solutions, but it's good solution. It's good solution to be promoted more in Poland, but we now see that we really need a lot of work to make it happen all over Poland, and that we also, in the same time, we have different views, and that we have also some people thinking that, well, maybe we will have better solution, or at least a solution which is cheaper and which will be more efficient in terms of paying less for psychiatry. I'm joking a little bit, but somehow it's the idea behind some critics. And we really need a lot of help, and we really need a lot of real interest in psychiatry and real understanding in psychiatry to make these changes, because only through these changes we can dream about changing this situation we have now, and the answer for the question whether we are in better or worse condition than 5 years ago or 20 years ago. I don't know. And but at the end, to finish, one thing that Andrzej also somehow describing what happened to church, said that, okay, sometimes psychiatry comes to this void space left by not only church, but sometimes traditional family and other organizations in the societies. And I think that it's not necessary that we really want to be there. It's not necessary that psychiatry and psychologists, psychotherapy, that we want to be put at this place, at this role. And what is going on, that in the same time we have, of course, big problems, issues around mental health, but also we have a tendency, and we can observe a tendency to medicalize and psychiatrize many things which are going in society, in our families, in everyday problems. And we are, one of my friends is joking that sometimes we are like, you know, these mechanics. You are just coming with your car and you are leaving it and saying, well, make it be good car again. And I don't care what you will do with it, but it's your problem, it's not our problem. I'm just leaving you this car, and you have 5 days, and I will come, and maybe I will pay you. And of course, it's completely different story, but we even don't think sometimes when there is a problem with a child in school, or we have a problem with our workplace, and we are calling it depression, and we are calling it Asperger's syndrome. No more this name valid, but but it's in the air. And we are addressing it to psychiatry to solve it. And of course that if we are making this kind of demand towards psychiatrists, it's really impossible. We might be 10,000 psychiatrists in Poland and more psychotherapists, but in this way of addressing different problems which are psychiatry, no, they are not psychiatry. We cannot manage them to solve them. Okay, I think it's enough.
Thank you. Sarah?
I'm actually very happy that I came in last in this round, because my points are quite sort of summarizing what you said. So 25 years after talking about reform in Poland and about the crisis that we've had, we still do have crisis. We still have crisis in terms of number of staff. Whether we are better or worse, it's difficult to say, but for sure we have different tools to talk about. We are more aware of what we talk about, but if it's better, if it's solved, I don't think so. And it comes from, first of all, staff. One of the research project that I'm participating in is we researched the plans for young medical students, how likely they are to leave Poland. And among one of the questions, putting aside their plans to leave, among one of the questions we ask is what are their chosen specialization that they want to pursue. 7%. And we survey all 6-year students with all the universities. 7% want to choose psychiatry, and the rest go for more sort of hot and sort of syllable professions. Slowly, but it is comparison. This was the second round. The first round was much smaller. It was, I think, 5. It's 2% growing, but we'll see. We're now collecting another round. But I think it's also, when we talk about awareness and when we talk about crisis, we do need fundamental reform in the language that we use. And just to note, so far in our discussion, I've noted, when we talk about mental health, I've noted terms that we here have used: patients, treatment, rehabilitation, diagnosis, fear, support, company, which all indicate victimization of people who do need empowerment to deal with their own issues that they face in life. And going directly towards psychiatry is way too much, and this is over-medicalization, over-diagnosing. And even if you go to the pharmacy in Poland, you can just spend all the money you have and come out with 3 bags of pills for you name it. But the change starts in us and the kind of words that we use.
Thank you. Thank you for your remarks. I would say that we are in the moment of the debate that we said what was needed to be said, but also what we all recognize as true. When it comes, for example, to the context of the mental struggle, that we are all overburdened in the way that actually needs complex addressing, and also psychiatry as a new church is overburdened with this task, that we cannot limit ourselves with medicalization. And of course I agree, but if we consider all the topics that we tackled, and also on the previous panel, that, for example, we need to think about work, we need to think about education, we need to think about creating meeting spaces for people, we need to reintegrate former patients, we need to think about how we organize workplace, how long do we work, how are, for example, the norms of children upbringing, and so on and so on and so on. We can see that this monster of problems is only growing, and still we need to tackle this practically, politically. So my next question is exactly like this: okay, we can say that medicalization is not enough, that we also need to think about how we speak about the problem, but after all, we need to think who is going to address this and how? Like who we should hold responsible for bringing solutions if, for example, not the psychiatrist or not simply one ministry? How would you see, you know, the political approach here to appropriately address this question? And maybe we can start from Sarah to Natalia.
So I think my co-speaker, Mr. Szafrański, will support me a lot in that. And I think this is community. And starting from, as I already said, empowering people and being able to allow them to function and assist them in their natural environment or in the environment that they function, that will enable them to make decisions and make the choices that they are able to, where they're able to function properly, rather than, as we said, locking people away and then having a struggle to reintegrate them into society, which brings up yet another issue. I do have, actually, I don't usually bring my laptop with me for the talk, but I do have a really nice data. Sorry for not being able to remember that all. But this is the data from NFZ from between January and June from 2022.
National Health Service in Poland.
Yes, I'm happy to share that as well. But it did talk about the use of Ukrainian migrants or Ukrainian refugees who who came to Poland in terms of different mental health services that they've used. Most of them were were kind of the sort of issues related to stress, the PTSD, stress disorder, and all the somatic stress issues. But these were relatively sort of a light diagnosis in terms of the sort of scale, the scale that the NFZ operates. But majority of them were treated either in ambulatory care or full-time care, like 24 hours care, which means these people were straight of all institutionalized. So imagine those people who came from the setting that they came, and first of all, they end up in institutions in Poland that, let's face it, they're not very people-friendly. And they're also, on top of that, we do talk also about difference in cultural competencies, where Polish practitioners, in majority, not all of them, did not have skills, were not aware, because why would they? They were not prepared. One of the solutions that could have been then introduced is simply the groups or the sort of support groups that many NGOs have done at this time. So even if it was just a simple, I don't know, drawing, knitting, whatever, this was something that allowed those people to open up. And then all of a sudden it turned out that those women don't sleep at night, that they hide their sons and children because they don't want them to go to Ukraine, and that they actually cannot focus, cannot function properly. And yet those few minutes of talking was much more productive and was much more powerful for them than any other medication that they could give. So back to your question, I do believe is the community-based support. And we've already mentioned Mr. Balicki's attempts to reform, but I'm very much in favor of that. I do cooperate with the hospitals in Krakow. And I would believe that this is definitely the way to continue.
Okay. Maybe a short comment about this situation with after Russian aggression on Ukraine started. And from the point of view of mental health centers, we were just when it happened, we expected just a tsunami or a wave of people coming from help. And we are Wola Mental Health Center, so we have Warszawa Zachodnia railway station near to our place, and the big, that time with a big place for receiving these people coming. So we organized translators, we organized, well, we were prepared for additional time. and additional space to accommodate these people. And of course, we talked to psychologists who is speaking Russian, who still remember Russian at school. Older people remember, me remember a little bit, younger not. Anyway, nothing happened. Of course, we had some patients, but it was really, and those data from National Fund, we asked them as a Polish Psychiatric Association at one moment, and it was really in a situation when the Polish government gave those people from Ukraine full access to mental health without payment. So there are different explanations, but colleagues from Ukraine told us, among others, that in Ukraine you don't have, this culture or this thinking that you are looking for psychiatric help even if you are in a bad condition. And about those institutionalized patients, of course, most of them were just patients with serious mental illness who came to Poland. So they really, this was not, kind of overacting, hospitalizing all, and not all of them. At least I think part of them were just in a hospital because they really needed this treatment. Anyway, coming back to the question who is responsible, my opinion is that first of all we must ask for good policy, state policy and political decisions, because without these political decisions we will have nothing. And we hope that now we are in this fortunate somehow moment when it will be possible to improve what's going on in child and adolescent psychiatry in Poland, and this cooperation of different ministries will also give this reform possibility to be really based on schools and on real contact with the population of child and adolescents, and that it won't be only the psychiatric issue. And the other decision we are waiting is the decision to really make the progress in this reform of adult psychiatry. We still don't know what will happen. We have this program which started now it will be 5 years ago. It was supposed to end after 3 years. It was extended because of COVID, then it was extended because of the war, and now it will be extended because through all this time it was not possible for the past government to prepare our legislation and needed things to really make this program happen in the whole Poland. So we hear that, okay, we will have again 1 year of this pilot program which is now for the half population of Poland, but without organizational standards, without just giving people who are creating these new mental health centers indicators, advice, what they should do. When we started with Andrzej this 5 years ago, it was, I think, 33 centers started. Usually we were well prepared. We were psychiatrists who knew about community psychiatry and who were somehow enthusiastic. And we had at least teams with several people who were involved, and it was possible to start easily. And now sometimes this is going on in the places where really they don't know what is this community psychiatry, and it's not so easy because it needs changing in thinking. It's coming from individual work to the teamwork. It's about cooperation. It's about networking. It's about making this cooperation with social care, with primary care doctors, with looking for work and helping people to really participate in community, to establish some kind of cooperation with NGOs, many things which true psychiatrists think are useless or are not my work. But also this kind of change is change which for some psychiatrists is dangerous, because I'm not, Andrzej is still the most important person here in Cieszyn, and I think that I'm still important, but in many teams we became not so much important, and I think it was very, very important thing about this different, that we need these teams which are not based only on doctor expertise, on psychologist expertise, that we need to engage many, many, many other people who can help in mental health problems. Anyway, it's a process, and this responsibility, and this part of responsibility is on us, on mental health workers, but part of it is also on these local governments. Part of it is on this local administration, and part of it is of course on local communities, and I'm quite pessimist about it, because still in Poland we have a lot of stigma, and we can say that probably all over Europe we have a lot of stigma, and we have a lot of anti-stigma programs which, in my opinion, do nothing except making those people who are making these programs happy and thinking that they are good. But we have some research in Poland showing that during last 30 years about stigma there is not a big change, and somehow it's very good that we are talking more about it, that we have people, celebrities, saying, publishing books about their being bipolar or being depressed and so on and so on. And of course it was really almost maybe impossible 30 years ago in this country, and now it's quite possible, and but still it's not, it doesn't mean that we have big change. Sorry, I'm talking too much, I'm a psychiatrist.
No, but thank you. And I think both of you very well highlighted like the importance of the language and the communication around mental health, which I think, and like the translation of the language that we use regarding mental health. Mental health is a collective problem, and the solutions to it, and to find the solution to overcome it, we need everybody on the board. We need all the generations to be on like around the table. We need all the groups presented to the table to have the intersectional lens in order to understand what is missing, what are the needs. And when it comes to policy, like the European Youth Forum has been long-standing advocating for an EU youth test, which is the bridge, kind of like to build the bridge between the gap between policy and the young people's experiences. In simple terms, the EU test sets out a framework for evaluating the impact that any new proposal may have on young people in the EU level. And we were very happy that the European Commission actually recently this year implemented the EU youth test, but now it's called EU Youth Check, marking a milestone for us in the European Youth Forum that now young people will be part of the processes, not only when it comes to, for example, policies regarding young people in general, but in all the policies, like what kind of affection they might have in the lives of young people. And of course, the national authorities play a big role when it comes to overcoming problems regarding mental health. National authorities are in a big role when we think about how do we create the social welfare system that works for young people, that works for everyone. How do we end the back-to-back temporary contracts? How do we have universal workers' rights? How do we build awareness regarding workplace rights? How do young people know what their rights are? That is something that the national authorities have a big role in playing. And also, national authorities have a role on how do we shift from from the idea of having a minimum wage to how do we have a living wage. There's a big difference between those two terms, and I think the national authorities play a big role in that, and those have a huge impact on the mental health of young people and mental health of everyone as well, of course. And of course, when we think about the solutions as well, we need the EU and the international community be on the board as well, like putting the resources on the already existing roadmaps and aims and settings and goals that they already have already regarding the mental health. But yeah, in the short, I think it's just like everybody needs to be in the board. That's the only way how we can find solution. Mental health is a collective problem that is affecting everybody in the society in a different ways, but it is still, and to understand what is missing and what needs to be done is that we need to hear the lived realities of everyone impacted in the society.
I think it's a nice wrap-up for the debate. So thank you all for the participation. Maybe we have some time for at least one or two questions, or commentary, if anyone from the audience would like to add something or ask maybe a question to anyone from... Yeah? Come on, Mateusz.
Just a quick question / comment, so we don't feel that we agree too much, because we need to be self-critical. And I would say one of the major dangers for the EU is when the EU, we've been talking with former commissioner on that, is framed as something putting regulations from above that destroy communities and people ways of life. And the concept of therapeutic state, which was not created by some crazy right-wingers, but by Christopher Lasch, for example, is something we should be very careful of. And I think that's why community is really important. Vice Minister Piechna Więckiewicz is not here at the moment, but I think what she said about the school is extremely important. And because it's an existing institution in small communities. I used to be, in a village, small school, cultural center, political center to a certain extent. So this is something very different, very bottom-up, not top-down. And I would also say not excluding existing communities that don't fit very easily into progressive framework. I was able to come quite well, I think, at least through the first wave of the pandemics, because I have a close, supportive, Protestant, charismatic Christian community, which was supporting me. So I would just be very attentive to the dangers of EU policies, as we saw with many stuff, don't want to get into the agricultural stuff, but getting involved people who are not usual suspects in supporting the kind of social democratic talk on board. I think this is really essential for the cohesion or even the very existence of the EU. Thank you.
Okay, Sarah, one last remark and then
I think
wrap up.
To support you in that, one of the main conclusions from the FEPS report and FEPS study that we were doing was, one of the question was how European Union what role can European Union play in improving mental health, and one of the main recommendation was to support communities and funding for communities.
Yeah, thank you.
Thank you.
Thank you for this input. I also believe it's important that we maybe transform, especially on the basis of this issue of mental health crisis, from being subject to being agents of political change. And of course it can, merge into various forms. And on practical level, we still need, discussions and implementations. But for now, unfortunately, we need to finish this part of the program. So thank you all. And I hope that you enjoyed the participation in this discussion. And, well, good health to all. Thank you.
Let's meet here in 5 minutes, and Paulina Nowak, who will be the chair, will take the floor 12:20.